we have one person in the Alice Springs ICU. We have 19 patients in the Alice Springs Hospital, 2 in Tennant Creek, and the remainder are at Royal Darwin Hospital. There were 284 cases of COVID-19 recorded in the Northern Territory until 8 p.m. last night, and 149 of these came from RAT tests. There were 1,303 PCR tests conducted across the Northern Territory yesterday, and the total number of active cases of COVID-19 in the Northern Territory now is 3,951. In terms of regional breakdowns, 2,115 of those are in the Greater Darwin area, 535 of those are in Alice Springs and communities outside of Alice Springs in Central Australia, 70 in East Arnhem, 194 cases in Katherine, and 35 are in the Barkly. In terms of an update for Alice Springs, there are no new cases confirmed for Abbott's Camp overnight. There are 2 new cases at Old Timers Camp in Alice Springs. This is not the Old Timers aged care facility. This is the town camp that is next to it. And of course, we are doing contact tracing in there, given the vulnerability of the residents in Old Timers Camp. There are 6 new cases at the Alice Springs Correctional Facility, taking the total case count to 27. And at the Old Timers Aged Care Facility, there were 4 new cases, and that takes the total to 15 there. We've also had 1 additional case in the Alira Renal Hostel in Alice Springs. I now need to move to an update, and a really important update, about Galiwin'ku. There are now a total of 19 cases in Galiwin'ku, and 6 of the 19 are staying in isolation in a motel on the island, and while 13 others there who are known close contacts are isolating as well on the island. Our vaccine rates on the island are okay, but slightly lower than other East Arnhem communities, and this is a very isolated part of the Northern Territory, so we have many people there with complex needs, and for this reason we will be moving to a 7-day lockdown of Galiwin'ku and Elcho Island from today at 2 p.m. What we want to do is limit the movement of people in and out of Galiwin'ku and Elcho Island because, of course, we know it's not just about Galiwin'ku, the main community there. There are a lot of homelands there and they move amongst each other on the island. We want to make sure that we slow the spread of COVID there. That is really important. We think it will be very difficult to eliminate COVID-19 from Elcho Island there and from Galiwin'ku, but that is why we are putting in this lockdown for 7 days so we can do this important work around testing and trapping the virus where we can and making sure we slow that spread. And importantly, help as many people stay on the island as possible because people do want to stay close to their home. And also to Yirrkala today. There were 2 new positive cases in the last 24 hours, and we have had a positive return of wastewater out of Yirrkala, confirming that we absolutely have COVID within the community there. As you know, we have sent in additional resources to do testing right across Yirrkala, and for the reasons I've just outlined, we will be also moving to a lockdown situation of Yirrkala from 2 p.m. today for 72 hours, so we can get more of that important testing information back. The lockdowns of Yirrkala and Galiwin'ku will actually have to apply to everybody, vaccinated and unvaccinated, because we want people to stay at home. And people in these communities will only be able to leave their homes for the following reasons: medical treatment, which does include testing and vaccination, for essential goods and services, for an hour of exercise each day where they will have to be masked up for that, and to provide care for somebody who is unable to provide care for themselves. And I also just want to remind people that if they are fleeing domestic violence, they can leave their home. So just to confirm that we are moving to a 7-day lockdown of Galiwin'ku and Elcho Island. That will be taking place on 2 p.m. today, and a 72-hour lockdown of Yirrkala from 2 p.m. today. We will send testing teams in there, of course, to make sure we can find as many cases as possible, which is very important. To Yuendamu and Yirrkala. There are now 7 new cases in Yuendamu and 6 more cases in Yirrkala. And this brings the total case count of these 2 communities to 72 and 57 of them in Yuendamu. The lockout in these areas is going well. We are slowing the spread of the virus. And again, we really want to thank the people on the ground in Yuendamu and Yirrkala for everything that they are doing to comply with the requirements there. At Amungana, we've had no new cases, so the current case count stands at 21. At the Darwin prison, there was 1 new case, bringing the total cases to 4. Yesterday, 340 inmates and staff had their first PCR test in the prison, and it certainly enacted a very strong measures and a COVID-19 response and management plan in there. So again, to the people of Galiwin'ku, Elcho Island to Yirrkala, we know that this will be a difficult few days ahead, but again, I just really want to stress to the communities, if we do the hard work up front, it will slow the spread. It will help make sure that we can keep more people well to stop them from getting COVID-19 and make sure that we get through this the best way possible. But thank you to everybody there. We know it's going to be a really trying week in Galiwin'ku and Elcho, and of course a few days in Yirrkala, but thank you to everyone there. I'll now hand over to the Chief Health Officer, Dr Heggie, for his update.
Thank you, Minister. So I believe these controls are very appropriate. We're dealing with locations where to retrieve people if they're unwell is complex, and having people who are able to stay in their country is also a really important approach. I'd like to say that the numbers are very pleasing. Now, we've got lower numbers and no number of cases in remote locations, and some of the high-risk settings like aged care have not increased, so that's a good thing as well. And we know that there's vulnerability as well as proximity. I think probably I'd thank the people who have been complying with the controls, the public health measures that we have in place. Those who've undertaken vaccination, I think that's wonderful. I applaud you, but don't forget, you're not out of the woods yet. The first dose needs to be then timed with the second dose, and of course then there's the booster. So that's a really important message. This isn't going away in a hurry in the sense of protection of people and limiting hospital presentations. I will say that the numbers that really pleased me are the numbers, the presentations, and also admissions to intensive care. We believe that we're dealing with mostly an Omicron outbreak, and that's good, but it's very, very transmissible. You can catch it very easily, and some of these people have just been in proximity for a short while in a vehicle. So I want to say, please come with us on the journey. The mask wearing, one of the most important things that you can do. Don't forget check-in, because that's a way of contact tracing and also demonstrating to the venue or the activity that you've got your vaccination that's going to prevent you from having harm and not infect people in those premises or that activity. So let's go on the journey together, because we've got a slight reduction in numbers, and this is an opportunity for all of us to review our plans. We're reviewing our plans in terms of where we go to in the future. And importantly, COVID care or COVID in the home that can be done safely in urban centres, regional, and also in remote locations. And that's going to be the way it is in the future. Thank you.
Thank you, Minister, and thank you, Doctor. So I'd ask all Territorians who are planning travel into the lockdown areas of Yirrkala for the next 72 hours, or to Galiwin'ku for the next 7 days to revisit those plans and restrict unnecessary travel, please. Both lockdown zones are introduced to place measures to restrict movement, so teams of health and police can surge in and get an adequate assessment of what the infection looks like and control it and isolate those. At Galiwin'ku, we'll see over 20 health staff through MeWatch and Northern Territory Government go to the island to help the community work through the next 7 days. There are adequate supplies and provisions on the island. The island is one of the remote parts of Australia. It's beautiful. They've got adequate supplies, infrastructure and personnel to work through the next 7 days. We have 5 police on the island. A further 4 will surge in there today, and a few more will be visiting over the next couple of days. And they are supported by some very good Aboriginal liaison officers to work with community and the surrounding islands to make sure that the communication is there and the message is passed so everyone understands what's going on. This is really important stuff. The Yirrkala is 72 hours. The 72 hours is to allow the health assessment and police to go in and get an accurate picture of what it looks like. Wastewater is positive, and there's a couple of positives there, so we're going to get a proper assessment in there to make sure the adequate resources are applied into the future to protect those communities and Territorians. More broadly, Territorians, even across Yuendamu, Yuelamu, Amungana, Alice Springs, practice hand hygiene, practice social distancing, adhere to the mask mandate. I noticed a lot of people are actually wearing the mask outside of closed premises too, which is really good. Also use the check-in app. You'll see the SMSs continue to go out to advise people that if you get symptoms or feel unwell, isolate and test. Thank you.
Questions?
So if we can just ask about this instance of cases at the Barclay work camp, do we understand whether or not they're linked at all to the 3 absconsions that occurred there over the weekend?
The advice I've got is no. That was one of the first questions that we asked, was with regards to whether or not they posed a threat. And we might also, if we could take the opportunity to get the acting commissioner just to update people on where those investigations are with those 3 abscondees, because we do want the help of the community to find them. So please.
Just so for that question, I'm aware there are no cases at the Barclay work camp. The 3 absconders that left the location, Ezra Austral, Penwood, and the third name escapes me, Cutter. They're currently, our information suggests they're in the proximity of the Tennant Creek Township. Some people saw them yesterday, believe they're still wearing the same clothes, the blue shorts and a yellow and green shirts. They are in the outer proximity of the township. I'd say they're hiding from police. I'd urge family members and those 3 individuals, if you are listening or you hear this message, to surrender yourself to police. There are lots of police in the area. They're looking through the area. We have aerial support. We have the tactical response group in the location, supported by detectives and our operational members. Also concerns me too with the conditions in Tennant Creek at the moment. It's hot. They need water. So they need to come forward so we can look after them and offer a safe resolution to this. So investigations are still underway. I have a high level of confidence we'll look after these people and find them soon.
While you're there, actually, there was a vision of people being taken into police custody at the Free PNT protest on Saturday. Have they been arrested? Are they facing any charges?
So there was 1 male arrested for assaulting police during the protest. He was subsequently released without charge, and there's further investigations continuing into that. No other infringements have been issued in relation to the protest activity, but our Operation Crown and General Duties members are looking at that aspect as well through, obviously, video footage and the like, and police officer statements.
And just want to return to those 3 absconders who are still on the run. It seems the case, though, that though obviously they present, I'm sure, other threats, they don't present a COVID threat at this stage.
They definitely do not present a COVID threat. They are, I urge people, members of the public, if you do see them, ring 131 444, or if you have to, 000. We will engage with them and take the necessary action.
In terms of Yirrkala, they said they're concerned there was a positive person in the community that has since been moved, yet the health clinic there has been closed since, and NT Health hasn't done any widespread testing in that community. They say they've been told to acquire their own rats from private avenues too, which at the best of times is a difficult job. Is the government sure that there are no further cases in Tijikala and that there's an appropriate health response?
I haven't got an up-to-date brief on Tijikala and the response there, but clearly where we do see situations that do occur that we do require to send additional health resources into, we do. We've got a proven track record of doing just that.
In terms of the Juno Creek or Ross facility, are they either of them being thought of to be stood up to support isolating options for people in remote communities in particular?
When we're looking at our major places like Tennant Creek and Alice Springs, of course we want to make sure that we've got the right accommodation available for people, because some people will not be able to do COVID at home. They will need somewhere to go. Some people will require additional medical supervision, but it won't be the level of medical supervision that requires them to be hospitalised. And it's really important that we don't use important hospital beds for those purposes if they're not required. So we have got the Todd facility. It is operating really well. In Tennant Creek, we're looking for further options that might be available for us to utilise. But one thing I want to be very clear about is that the Centre for National Resilience has additional capacity, so we are able to locate people to the Centre for National Resilience if we need to as well.
How many people are currently based in Howard Springs and Todd?
In Alice Springs?
In Howard Springs?
Howard Springs, under 200.
And what's the capacity of it?
Thousands.
And I understand that Defence Forces might have stepped up in the Howard Springs facility. Do you have any information on that?
We've been hand in hand with Defence along this whole journey with COVID-19, and I just want to absolutely applaud the Australian Defence Forces and also the AFP because throughout the pandemic we have had often requests that have gone into the AFP and also through to the Defence Forces, and they have assisted the Northern Territory to make sure that our resources can be put where they are most needed. So we will continue that relationship working with the ADF and the AFP.
What's the Todd facility's capacity like at the moment? How many spare rooms are there?
We do have capacity available, but it is a very busy place at this point in time.
Do we have numbers?
We'll have to get back to you with those, Miles. I just don't have them at hand, but this is something we ask every day. It's important to recognise that in some days we have new admissions come in. We also have people that move out because they're no longer required to be there or they're over their infections. So we've certainly seen that there has been an uptake in the Todd facility and that we've got plenty of people there now. It is a very, very busy place. That's why we're being very conscious about making sure that we're clear with people that if we have to transfer people to the Centre for National Resilience, we will be doing that. We know people from Central Australia would ideally prefer to stay in Alice Springs and a bit closer to their country and to their connections, but in some instances we may need to move people up to Howard Springs to the Centre for National Resilience.
So you wouldn't consider setting up a second isolation facility within Alice or Tennant before sending them to Howard Springs?
Of course, we are looking in those regions just to see if there is other appropriate accommodation, but we have got the gold standard, world-class Centre for National Resilience in Howard Springs with additional capacity. And I think that should give great comfort to the people in the Northern Territory because they know if they get sick and if they need good care, we have got plenty of room there at the Centre for National Resilience where we have medical practitioners, doctors and really dedicated staff to taking care of them.
How difficult is it to police a lockout in some of these remote and regional areas, given how big the area is and how many back roads there are?
Well, each community is different, and I'd say Elcho Island and Galiwin'ku, being on an island in a very remote place, and the police there that we have serving in Galiwin'ku are extraordinary. We've got some fantastic ACPO. We've got wonderful Aboriginal liaison officers with very strong connections to community, and people want to stay on island. So we expect that we are going to see great cooperation from traditional owners and the people of Galiwin'ku and the homelands that also use Galiwin'ku as a service hub. With that, and as we know, it's very difficult leaving Elcho Islands because your only options are by sea or by air. With regards to Yirrkala, of course, very close to the Nhulunbuy township, but effectively we've got one road coming in and one road going out. And again, it is just a fantastic community, very strong traditional owners and leaders, and we have absolutely no doubt in the leadership on the ground there and the level of cooperation we will see through these lockdowns. Central Australia again too, we have seen Yuendamu and Yullamu do a magnificent job, and Amungana. They are working well. We know that these situations are very difficult for people on the ground. We are trying to get through these as quickly as possible, and my message to all the people in communities that are affected by lockouts and lockdowns is that we know that they are inconvenient. We know that they can be really, really hard, but this is about keeping you safe, keeping your family safe, keeping your community safe, and slowing the spread of COVID-19 to make sure we can give the very best support to the people who unfortunately will get it.
Two issues on East Arnhem around lockdown there. Why not lock down all of the Goa Peninsula and Nhulunbuy?
We really carefully discussed that because we know that there is a really strong relationships between the homelands and Yirrkala. So we did discuss that very closely, but after we had a long conversation about that, we decided that we felt that a lockdown to Yirrkala was sufficient.
And in terms of another issue, and perhaps more so with Galiwin'ku, is when you have people who live in Galiwin'ku, but they can't get back now at the moment because of the lockdown situation. What's the plan for people who might be in urban centres who are trying to get home now for next week?
Well, we would say to people that are residents but don't want to return or can't return, that we would say to them, reach out to our organisations. We've got accommodation facilities here in Darwin that are for people from remote Aboriginal communities to give them that additional support. There are options there and there is support out there.
And that support will be provided them for free? Because, I mean, you may well have come into Darwin for whatever reason.
Some are on commercial arrangements and other times we can find appropriate accommodation.
Yeah, for the Chief Health Officer, hospitalisations seem to be kind of, if we look at maybe day to day, they can't sometimes bounce around a bit, but tend to be trending upwards a little bit, particularly our acute admissions seem to be rising a little bit. You still seem comfortable about this, relatively speaking, then?
It's all about the detail because a lot of people are there not for their COVID-related illness. They might have other illnesses, that's number one. Sometimes it's assessment for their wellness in terms of whether they go to the hospital or they can go to particularly the Todd facility. So although the numbers actually seem to be increased, when you actually adjust it for population, our numbers are very, very small, and that's both in the percentage of people per 100,000. I think probably Tasmania is the only place that's doing as well as we are. So yes, and people will come in and be then assessed and then go. What really pleases me is we've only got that one person who's been admitted into the ICU facility in Alice Springs Hospital, and sometimes we know that some people are there because they're a carer or a parent. Yeah, thank you.
We do know that there is an increase in acute patients, though. That must be a worrying statistic.
Sorry, I missed the question.
The increase in acute patients, that must be a worrying statistic.
Well, I think I answered that question in terms of acute patients. That's patients that are actually being there for assessment because sometimes it's uncertain whether or not they would need to be hospitalised. So acute presentations is different than admissions. And most importantly, it's those who need high-level care. So again, per population, our numbers are actually really low. So I point to that number rather than just the actual the numbers that we have. We've had quite a lot of cases up until today. It seems to be less today. We've always got to manage that some of these are going to potentially go up, the numbers go up because of self-reporting of rapid antigen tests.
We've heard that internal health modelling suggests that for every 100 Omicron infections, one person might end up in hospital with varying degrees of severity. We're still seeing triple-digit figures for quite some time. At what point will our hospitals no longer be able to, what is our limit in Darwin Hospital?
Well, I think that we've got very good availability of hospital beds, and we've got good ICU capability as well. but we are going to shift more importantly to the people who do not need hospitalisation, actually to be cared for away from that. Now, it could be that it's in a quarantine facility nearby, or it could be in the place where they live. It might be an alternate house or similar. So again, I think that the numbers to me are not great, and I have every comfort at the moment. But the message is get yourself vaccinated, because that's the thing, irrespective of if you have to go to hospital, whether you'll actually get seriously unwell.
Bill Yan, the opposition health spokesman, has spoken about these texts that have been provided after a backlog. This may be one for the acting health minister, deputy chief minister. They do provide a fairly lacking amount of detail. What good is that going to be then if we don't get any location or time frame when we're being alerted about this?
Well, I think everybody needs to understand that when you leave your home and you go out in the Northern Territory, there is COVID right across the Northern Territory effectively, so you're potentially at risk when you leave your home. The exposure site alert, just make sure that people know that they have entered a place that we now consider an exposure site, and that if they become symptomatic, to go get tested. So it's really about making them alert to if they show any symptoms, and they should go get a COVID test.
But other check-in apps all around Australia tell people, no, this is the site you're at on this day. Why can't we get any sort of detail around that?
Yeah, effectively, for us, it's about making sure people monitor symptoms and they know that they have been somewhere that effectively is considered a exposure site. So it's about self-monitoring symptoms, to not be alarmed, but if you become symptomatic, to act upon it.
But they don't even know what the exposure site was or what day it was. So that whole 4 days and everything around that, they're flying blind.
It's about making people conscious about if they become symptomatic, to make sure they go get tested.
How many tests have been sent?
Sorry?
How many tests have
I
actually been sent?
don't have the exact numbers, Easy.
Shouldn't you, since there was that gap of 10 days in which zero tests were sent?
I didn't get the exact number ahead of my briefing today, so by all means we can follow that up for you.
You mentioned that there's a COVID management plan in place at Darwin Prison. What is actually meant by that? Prisoners locked in their rooms?
So the Chief Minister went through that at his press conference yesterday about what that COVID management plan looks like, and some of the work that they're doing with prisoners, because clearly being isolated in rooms in a prison is really difficult to make sure people can get outside and do those types of things. So the COVID-19 measures and the management plan that they've got in place are very appropriate for a prison setting.
Last question, guys.
No.
I would actually like to ask the Acting Police Commissioner a question about the death in Karama. Do you have an update on that investigation?
No, my latest update is that after midnight last night, a member of the public got waved down by a rough sleeper, advising that a 47-year-old female was unconscious. Police in St John's responded. Sadly, she passed away at the scene. We're unsure. I'm unsure of the circumstances of that event at the moment, so we treat it at the highest threshold. We've declared a crime scene, and detectives are currently investigating and speaking with witnesses.
Did she have any injuries?
I'm not aware of any, no.
Chief Health Officer, sorry, just very quickly. Our cases have dropped off a bit today. Should we be inferring that that's somehow a waning of the virus, or is it the case that we shall see this kind of ebb and flow?
That's a good question. I think probably what we're seeing is the people who got infected at various New Year's Eve activities and venues, maybe the transmission is not spreading further at the moment. But as the Minister said, we have COVID-19 in the community, and the most important thing is to recognise that if you get some symptoms, to go and get tested, and please respect the resources, rapid antigen tests. Don't go because you're worried. Go because you've got symptoms. That's the most valuable time to get a test. Thank you.
Thanks, guys.
Thank you, everyone.